Hi everybody, Judy Seeger here, your host for the Frontier 3 Ozone Therapy Conference coming up in Santa Barbara, California with Dr. Mark Weiser. And we're so happy to have you here to listen to another interview from one of the speakers that will be at the conference. We have speakers coming from all over the world to teach how ozone therapy has worked in their practice very successfully. And today is no exception. We have a wonderful speaker, Dr. Lamberto from Italy. Thank you so much for being here today, Doctor.
Thank you for inviting me. Thank you to you. Thank you, Dr. Weiser, and all the people there. Thank you very much.
Fantastic. So Dr. Lamberto has been in the medical field for over 45 years, practicing in Italy. He is a specialist in pharmacology and also has been using ozone therapy for over 27 years. So we have a true expert here who's going to be speaking at the conference about the metabolic activity of ozone therapy in the body. Dr. Lamberto, can you please tell us how you have been finding the ozone therapy works in your practice? What do you use it for specifically?
Yes, the main topic is aging, is to prevent the aging.
So anti-aging, anything against aging in the body is what you use it for. Okay.
So aging is illness sometimes. So if the process of aging is too fast, so we can have illness. If the process of aging is low, we can have health. This is the reason why we have a lot of beautiful results with ozone therapy. At the beginning, I wondered myself, and my question was, how could it be possible that one gas like ozone, that is an oxidant, could be helpful in many ailments, including pain, including detoxifying the body, including aesthetics, and a lot of neuroimmunology, immune system. So my question was, how could it be possible that we have this? So the aging process is the key to understand how ozone works.
Dr. Lamberto, that's really fascinating because we always want to slow down the aging process and, of course, avoid disease. What made you decide 27 years ago to use ozone therapy in your practice?
Yes, was at the beginning, so perhaps now we have more information. But the main reason was that one professor of pharmacology in Cuba introduced me for the first time. And she asked me, why, Lamberto, are you doing work, scientific work, excellent, studying neurophysiology of the body? Why you don't try ozone? I was impressed because being a pharmacologist, like most of the doctors that now can understand exactly how ozone works, we know that there is biology and there is a receptors in our cells. There is a medicine that acts in this receptor, giving a biological function. This is our idea, but our idea is very strict, does not work properly. And she told me, Lamberto, please give a look to ozone. Ozone is an oxidant. If we give an oxidant, just a simple gas, without receptors, but our cells that burn oxygen, they produce oxidative stress during our life. If we give a small oxidative stress with ozone, we can have a powerful response in terms of antioxidant. So that was for me great, because I started to realize for the first time that it could be possible to give well-being or health to one cell of the skin, one cell of the immune system, one cell of the muscle, one cell of the... So for all our body, all our cells, they are programmed to burn oxygen, to produce ATP. This process produces oxidative stress, damage the DNA, and some illnesses appears. Immune, cancer, pain. So this was the reason I want to know more. Now, in my next conference, I will explain the last data that we realized and we found in the science, in the the papers published in this field, in the oxidative stress, explaining how ozone really could be so helpful in many ailments. Just using a simple metabolic pathway that is the same in all the cells that must defend its cells from the damage of oxidative stress. Natural occurring oxidative stress, that is the aging, or the pathologic occurrence of oxidative stress, that is when a cell loses own health.
So, Dr. Lamberto, thank you for explaining how you're using that in your practice. And now with the anti-aging in Italy, what kind of results are you seeing with your patients?
So we see our patients, usually I treated about 25,000 patients.
25,000 patients, wow.
25,000 patients the last year. Now I can see for every patient, I have a paper, I have a schedule of all the patients, and we can know exactly the percentage of cancer in these patients, or how many patients reduce the aging processes. So increase the well-being in terms of well-being health in the aging, but also in pain and in many other processes. So now in my great experience, I can say exactly that ozone is a complement, so we must be sure we can't give some promise without clinical data, but could be very, very helpful in reducing the pathology of some illnesses and increasing our immune system efficiency. So if our immune system works fine, our body will be fine.
Yeah, for sure. And Dr. Lamberto, your method of using ozone therapy, to use it as a MAH injection, in a sauna, in what capacity are you using it?
Yes, the most used protocol is measure autoimmunotherapy, just a systemic treatment. As you know, when we give a small oxidative stress to one cell, we can have a response for that side of the cells. But if we treat in systemic way all the body, we can see that all the cells of our body increase the antioxidant activity and start to produce detoxifying substances that protects our body. So mainly, I say that ozone therapy is one therapy for healthy people, not for sick people, just to prevent illnesses. Mm-hmm. Because we can maintain an equilibrium between pro-oxidant and antioxidant. That is, so it's more difficult to come back to heal, and it is more easy to protect against the damage.
Yeah, for sure. And Dr. Lamberto, so doctors who are skeptical, doubtful about using ozone therapy in their practice, what would you tell them the reason they should include ozone therapy in their practice?
I can tell them that partially I can agree. Me too, at the beginning, I was a little bit skeptical because I don't know. It's a new thing. We don't have courses in the university. So it's normal. How can I believe? So most of our colleagues, me too, I can explain exactly how ozone works. But now, what occurs? In these 25 years, 27 years, I studied a lot, more than the course for medical degrees, because we don't have any book that can explain exactly how an oxidant can give back an antioxidant response. But now we have the metabolic pathway. So I can understand these people, these skeptical, because my students in the course of medicine, doing pharmacology, I explained to them that we have a substance, that we have a receptor, and there is an effect that is dependent on the dose. This is completely different now. Now we need to modify our way to think the medicine, and that we can think that some stress, that could be an oxidative stress, could be just simply an exercise every day, the same diet. So if we modify our food intake, we can give some medical treatment to our body. How could be possible to study by a clinical point of view the modification of our body after a diet, after an exercise? Is very easy, because we can see exactly a modification of our body receptors. For example, what I mean, if I want to use a beta blockers, okay, beta blockers works very good on my heart because reduce my frequency. What does it mean? That there is a mechanism that I can evaluate statistically, and I can produce papers on scientific big journals. It's very difficult with ozone or any other support like ozone that give an oxidative stress, and the response depends on our body. With biochemical pathway so far not well identified, but now we are arriving to solve the problem.
So the conference, if they come to the conference and they hear you speak and they hear the other speakers, do you think that that will be enough to show them the effectiveness of how ozone therapy will work?
Yes, my topic will be on systemic medicine. What does it mean? So far, we look at organ medicine. So I give drugs for heart, for liver, for lung. This is organ medicine. Organ medicine, most of the organ medicine have a failure, big failure. Now, the approach is the system medicine. System medicine just means give a look to all our body, intended as a whole, holistic approach. So when I give some oxidative stress in every cells, a metabolic pathway move to improve the defense against oxidative stress. Does mean that if the cell is suffering, come back to be healthy. And if this cells is one lymphocyte of our immune system works better. Now we know exactly how is the metabolic pathways. Was published one paper about 5 years ago. And now they are studying, because this is like a protection in our body. Just because if we burn oxygen, we are programmed to burn oxygen. So there is something that could defend our body if we burn too much and if we produce too much oxidative stress. This pathway is now clear. I don't want to announce here. I would like to announce this in the Congress. And now this is the line that we must follow in the future. And we can understand how ozone could be so helpful for pain, could be so helpful for detoxifying, could be so helpful aging. So I mentioned just those
a few things, right? And so
where we can have beautiful results.
Right. Of course, in a few minutes, we are getting a taste of what you will be teaching at the conference. I know you're going to go into much greater detail at the conference, and people will be able to talk to you and ask you questions specifically. So it's a very powerful place to be, and I appreciate you sharing your experience and your wisdom on this, Doctor. We just want to encourage everybody who is viewing this that this is the conference where you're going to get the experts of the world, that you could speak with them specifically about ozone therapy in your practice and how it could benefit you and your patients. So we hope you come. The website will be below. It is Ozone Oxygen Therapy Group. So we want you to be there and come to the conference so that you could learn more. So thank you so much, Dr. Lamberto. Appreciate your time, and we'll see you at the conference.
You're welcome. Thank you to you, and thank you to all the listeners. Thank you.
Thank you. All right. Bye-bye.